The southern border is once again front and center on the national stage, with visits from President Trump and Homeland Security Secretary Kirstjen Nielsen this week. The president's push for increased security included threats to close the border, which would significantly disrupt trade and travel at ports of entries. It comes as Customs and Border Protection says facilities used to process immigrants are at capacity because of the ongoing surge in families from Central America. Last week, a statement from the Border Patrol Yuma sector said it began releasing detainees on their own recognizance with a notice to show up in immigration court. And this week, the Tucson sector said it's doing the same, continuing to coordinate with local non-governmental organizations to, quote, minimize the impact of these releases on the community. The Border Patrol calls these releases unprecedented. We wondered what considerations, if any, public health experts should take into account as large groups of immigrants enter communities. We explored the issue with Katie Tucker, a research specialist with the Arizona Prevention Research Center at the University of Arizona Mel and Enid Zuckerman College of Public Health. Mass migration of people, in this case 22,000 traveling through Arizona from December until now. Any risk presented to Arizona when you have such a large group of people passing through?
The health issues that we see from migrants who are crossing and who may come into our humanitarian shelters include things like dehydration, blisters, burns, scrapes, anything that you would expect from someone who just crossed the desert. We do also see things like chronic disease and respiratory symptoms and stuff like that, but they're not things that will cause harm to others. What we see is that the countries of origin of many of these migrants have higher vaccination rates than even we have in some states in the U.S. So in Guatemala, for example, many of the migrants come from Guatemala. Their vaccination rates range from 93% to 98%. In Arizona, we're 93.4% for school-aged children. So in terms of risk they pose to others, it's just non-existent. That's not really an issue that we see.
So many of these people, though, they may be coming from third world nations that are not quite as developed as the United States may be. They are receiving vaccines.
Yes.
Okay. And thus they're not necessarily presenting a public health crisis to our communities.
When we talk about public health, we talk about issues and diseases that can be prevented and conditions that foster health. And so, yes, the conditions that they may present with at the border have roots in where they came from, so in poverty and deprivation and violence, and they're exacerbated by their journey. But our public health systems in the U.S. are very well equipped to track and deal with communicable diseases or other diseases that we may not be as accustomed to seeing here. And these populations have the same vaccines that we have. So in terms of public health risks, it's just there's no evidence that migrating populations import communicable diseases. We've seen that in Europe. The World Health Organization reports that migrating populations do not import. There's no evidence to show that they import diseases into their country of destination. What we see is that diseases that we may not normally see in the U.S. are imported by travelers, tourists, maybe healthcare providers who go back and forth a lot more. But we have no evidence to show that migrating populations are causing any health outbreaks or any health issues in their country of destination.
What's the time frame? Because I can imagine some people who will be watching this and say, well, how can we tell if this is an unprecedented situation we've never experienced before?
I don't think this is unprecedented. I think that this is one chapter in a long history of migration. I don't have the exact statistics, but millions of people have crossed our border, and they do so daily between Mexico and the United States, legally, without papers, or just going back and forth to visit their family. So we have very effective public health mechanisms in place to track and control diseases that might happen.
Let's say these children from Central America reach their destination. Come the next academic year, they'll likely be enrolled in school. Any obligation on the state or federal level to be sure children are ready to go with vaccines, et cetera? Every
state allows medical exemptions, so if for some reason you are allergic or aren't able to have a vaccine, then you don't have to have one. And some states take it a step further and they allow personal or religious exemptions, and Arizona is one of those states. And what we see is that the population that is most likely to have exemptions from vaccinations means the children are unvaccinated. They're usually white and affluent, so it's a very different population than what we see coming across the border. In every state, they have these regulations and they differ by state, but before you enroll in school, you have to show proof of your vaccination, so according to the regulations of that state. So there's really no risk that a child will enroll in school without maybe a migrant child would enroll without the proper vaccinations and health checkups. And county and state health departments provide those services for free.
Based on your research, your research in public health, your work along the border, anything that you think the viewers ought to know as the situation continues to evolve?
I think it's important to understand that the people who we're seeing are in incredibly vulnerable situations. And there are a lot of fear-based messages that aren't based on facts. It's not based on the evidence that we collect in public health or in other disciplines. And our duty as public health professionals is to promote healthy conditions and prevent the circumstances that cause disease. I would say that the issues that we see on the border is not the danger that migrants pose to the general population, but rather the hardships that the migrants are experiencing as they come into our communities. And our focus should be on providing essential services for those migrants, timely and appropriate health care, safe and comfortable and healthy living environments. All of those things will promote health, not only of the migrants, but of any agents or volunteers or the general population who comes into contact with them.
Okay, Katie, thank you.
Yeah, thank you so much.